Blueberries. A superfood or a secret saboteur for your meds? If you're taking blood thinners, diabetes meds, or antidepressants, those little blue gems might be messing with your health. Ever heard of serotonin syndrome? It's a scary reaction triggered by mixing blueberries with certain medications. Let's dive into why this seemingly innocent fruit might not be so innocent after all. Number 1. Anticoagulants. Blood thinners. You're taking a medication like warfarin to prevent dangerous blood clots. You think you're doing everything right, even adding some heart-healthy blueberries to your morning smoothie. But what you don't know is that those blueberries are packed with vitamin K, a nutrient that helps your blood clot. That's right, the very thing your medication is trying to prevent. Suddenly, that innocent blueberry smoothie could become a recipe for disaster. The high levels of vitamin K in blueberries can interfere with your medication, making your blood either too thin, leading to bleeding, or too thick, leading to clots. It's like trying to drive a car with the gas and brake pedals pressed at the same time. Not a good outcome. Now, we're not saying you have to banish blueberries from your life completely, but if you're taking blood thinners, it's crucial to talk to your doctor about how to safely include them in your diet. You might need to adjust your medication dose or monitor your vitamin K intake more carefully. The key is to be aware of the potential interaction and take steps to protect your health. Number 2. Diabetes medications. Think of blueberries as tiny sugar bombs. While they're naturally sweet, they can also pack a punch when it comes to your blood sugar levels. For people with diabetes who rely on medications like metformin to keep their blood sugar in check, adding blueberries to the mix can be like throwing a wrench in the works. The natural sugars in blueberries can cause unexpected spikes and dips in blood sugar, making it harder to manage your diabetes effectively. It's like trying to balance a scale with a mischievous child jumping on and off. You'll never achieve stability. This doesn't mean blueberries are off limits for diabetics, but it's crucial to be mindful of your portion sizes and monitor your blood sugar levels closely if you choose to include them in your diet. Working with your doctor or a registered dietitian can help you find the right balance and ensure that blueberries complement your diabetes management plan, not complicate it. Number 3. Antidepressants. Blueberries are often touted as a mood booster, thanks to their antioxidants and vitamins. But if you're taking antidepressants, especially SSRIs, selective serotonin reuptake inhibitors, those same blueberries could throw your emotions into a tailspin. That's because blueberries contain compounds that can affect serotonin levels, a key neurotransmitter involved in mood regulation. When combined with SSRIs, these compounds can lead to a dangerous condition called serotonin syndrome, characterized by confusion, agitation, rapid heart rate, and even seizures. It's like adding fuel to a fire that's already burning out of control. Instead of feeling better, you could end up feeling worse, with unpredictable mood swings and a host of unpleasant side effects. Again, this doesn't mean blueberries are forbidden fruit for those with depression, but it's crucial to talk to your doctor about the potential risks and benefits. They can help you determine if blueberries are safe for you to eat, and if so, how much you can safely consume. The goal is to find a balance that supports your mental health, not hinders it. Number 4. Antibiotics. Blueberries are often seen as a health-boosting food, packed with antioxidants and vitamins that can help strengthen your immune system. But when you're battling a bacterial infection and taking antibiotics, those same blueberries could actually work against you. Certain antibiotics, like ciprofloxacin, rely on being fully absorbed by your body to fight off the infection. But the compounds in blueberries can interfere with this absorption process, making the antibiotic less effective and prolonging your illness. It's like trying to put out a fire with a leaky hose. You're not going to get the job done. Moreover, this interaction could lead to a bigger problem: antibiotic resistance. When antibiotics aren't fully effective, the bacteria they're targeting can survive and even become stronger, making future infections harder to treat. It's a vicious cycle that you definitely don't want to start. So, if you're on antibiotics, it's best to lay off the blueberries until you've finished your course of treatment. This will give your medication the best chance to work and help you recover faster. Remember, sometimes the healthiest foods can have unintended consequences, especially when combined with certain medications. Number 5. Blood pressure medications. Often celebrated for their heart-healthy benefits, blueberries seems like a no-brainer addition to anyone's diet, but they could be a hidden danger for those taking blood pressure medication. That's because blueberries contain flavonoids, natural compounds that can lower blood pressure. While this is generally a good thing, it can be a problem if you're already taking medication to control your blood pressure. Combining blueberries with blood pressure meds can cause your blood pressure to drop too low, leading to dizziness, lightheadedness, fainting, and even falls. It's like deflating a tire that's already low on air. You're going to end up flat on the ground. This doesn't mean you have to avoid blueberries entirely. However, if you're on blood pressure medication, it's crucial to talk to your doctor about incorporating them into your diet safely. They may recommend monitoring your blood pressure more closely or adjusting your medication dosage. Number 6. Statins, cholesterol-lowering drugs. Blueberries are hailed as a heart-healthy superfood, but for those taking statins to lower cholesterol, these tiny berries could have an unexpected downside. Research suggests that the polyphenols in blueberries, while beneficial for many, can amplify the effects of statins, leading to an increased risk of muscle pain, weakness, and even a rare but serious condition called rhabdomyolysis, muscle breakdown. Imagine trying to build muscle at the gym, only to have your efforts sabotaged by a seemingly harmless snack. That's the potential reality for those on statins who consume blueberries. The combination can be like a double-edged sword, offering potential benefits for heart health, while simultaneously increasing the risk of muscle damage. If you're taking statins, it's crucial to discuss your blueberry consumption with your doctor. They can help you weigh the risks and benefits and determine if blueberries are a safe addition to your diet. Remember, moderation is key, and it's always better to err on the side of caution when it comes to your health. Number 7. Non-steroidal anti-inflammatory drugs, NSAIDs. If you're reaching for NSAIDs like ibuprofen or naproxen to soothe aches and pains, be aware that blueberries could add an unexpected twist to the mix. While these over-the-counter pain relievers are generally safe, they can irritate your stomach lining and increase the risk of ulcers. Blueberries, with their natural acids, can exacerbate this irritation, potentially leading to stomach upset, heartburn, or even bleeding in the digestive tract. It's like pouring lemon juice on a paper cut. It might sting a little at first, but it can make the wound worse in the long run. While the combination of blueberries and NSAIDs might not cause immediate problems for everyone, it's crucial to listen to your body and be aware of any digestive discomfort. If you experience any issues, it's best to talk to your doctor about alternative pain relief options or adjusting your blueberry intake. Number 8. Chemotherapy drugs. If you're undergoing chemotherapy, you're likely focused on maintaining your strength and boosting your immune system. Blueberries, with their antioxidant power, might seem like a natural choice. However, these tiny berries could potentially interfere with certain chemotherapy drugs, hindering their effectiveness and potentially compromising your treatment. Certain chemotherapy drugs rely on specific enzymes in your body to work effectively. Blueberries, on the other hand, contain compounds that can inhibit these enzymes, essentially blunting the impact of the medication. Moreover, blueberries' high vitamin K content could also pose a risk, as some chemotherapy drugs can increase the risk of bleeding. Adding extra vitamin K to the mix could further complicate this issue and potentially lead to complications. If you're undergoing chemotherapy, it's crucial to discuss your diet with your oncologist. They can guide you on which foods are safe and beneficial during your treatment and which ones, like blueberries, might be best to avoid. Number 9. Medications for anxiety, benzodiazepines. While blueberries are often touted for their potential to reduce anxiety, they can unexpectedly interact with benzodiazepines, a class of medications commonly prescribed for anxiety and panic disorders. These medications, such as Xanax or Valium, work by enhancing the effects of a neurotransmitter called GABA, which promotes relaxation and calmness. However, blueberries contain compounds that can also interact with GABA receptors in the brain. When combined with benzodiazepines, this interaction can lead to excessive drowsiness, dizziness, and impaired coordination. It's like adding two sedatives together, potentially resulting in an unsafe level of sedation. If you're taking benzodiazepines for anxiety, it's essential to be cautious about consuming blueberries. While they might seem like a harmless snack, their interaction with your medication could compromise your safety and well-being. It's always best to consult your doctor about any potential risks and adjust your diet accordingly. Number 10. Digoxin, heart medication. If you're taking digoxin to manage heart failure or an irregular heartbeat, those juicy blueberries in your morning cereal could pose a hidden risk. Digoxin requires a delicate balance in your body to work effectively. However, blueberries, with their high fiber content, can interfere with the absorption of this medication, potentially lowering its effectiveness and increasing the risk of complications. Imagine digoxin as a finely tuned instrument, and blueberries as a disruptive force that throws it out of tune. The fiber in blueberries can bind to digoxin in your digestive system, preventing it from being properly absorbed into your bloodstream. This can lead to suboptimal levels of the medication, making it harder to manage your heart condition and potentially putting you at risk for arrhythmias or worsening heart failure. If you're taking digoxin, it's crucial to talk to your doctor about how to safely include blueberries in your diet. They may recommend spacing out your blueberry consumption from your medication dose or monitoring your digoxin levels more closely. By being mindful of this interaction, you can ensure that your heart medication works effectively and keeps your ticker in top shape. So, there you have it. 10 medications that might not play well with your favorite blue superfood. Remember, this isn't about demonizing blueberries. They're packed with nutrients and offer numerous health benefits. However, like any food, they can interact with certain medications and potentially cause problems. The key takeaway? Always talk to your doctor or pharmacist before making any significant changes to your diet, especially if you're taking medication. They can help you weigh the risks and benefits and make informed decisions about what's best for your individual health needs. Don't let a seemingly harmless snack derail your health journey. Prioritize open communication with your healthcare providers and make informed choices to protect your well-being.